Yeah. Two new specialties have been added to the list for the what's called the Expedited Specialist Pathway, or the rapid process for specialist IMGs to work in Australia. So in this video, I'm going to take you through what those two new specialties are and what the future might look for specialists attempting Expedited Specialist Pathway. We are on the Medical Board of Australia website. A reminder that the Medical Board is one of many boards under what's called Ahpra, the Australian Health Practitioners Regulation Agency. So about 15 years ago or something like that, all the state medical boards and state nursing boards, etc., got brought together into one national board or national agency as part of a reform to the system. So that the benefit of that means that if you're assessed for one state now, you can pretty much without interruption work in another state in Australia, which so makes transportability of health professions much more easier. So historically, for some time, we've had 4 pathways for international medical graduates to make it to work in Australia. We've got the first 2, which are the competent authority pathway and the standard pathway. These are pathways to registration if you're not a specialist or not completing specialist training. I'll put a link to a video I did about these pathways in the description and above. And then we have the specialist pathway, which is the main pathway for specialist trained international medical graduates applying to work in Australia. But of course, we've also had the short-term pathway, which provides a temporary route for specialists and specialist trainees to work here. So those 4 pathways have pretty much been there since the inception of the Medical Board of Australia, and they pretty much have reflected what the various states and territory medical boards did in terms of assessing IMGs. But in the last couple of years, a reform coming out of a series of reforms around medical or health workforce that are planned in Australia from the federal government has been this expedited specialist pathway. So what's the expedited specialist pathway? Essentially, it's a more streamlined pathway for a specialist international medical graduate to get recognised in Australia. If you're eligible for it, it's basically far more superior than the short-term training pathway. It's kind of similar to, but not quite the same as the competent authority pathway version of the specialist pathway, in that the similarity is that you often, your degree, your specialist qualification normally has to come from a limited number of countries, which generally reflect competent authority countries. But there are some differences, and we'll talk about that shortly. But there's many benefits to this pathway other than it being much more streamlined. But one of the key benefits is that you actually enter the specialist register once you're registered. So with the other pathway, there's a period of provisional work where you're under peer review and may have to do some examinations before you're actually able to get onto the specialist register. So the expedited pathway is different in that you can enter the specialist register straight away. So that probably opens up options in the private sector and the private hospital sector for some specialties as well. So let's just drill down here. So this is the expedited pathway. Who is this pathway for? As I said, it's for specialist IMGs seeking specialist registration in Australia. The type of registration it leads to is specialist registration, as they say there. Now, the key thing is who's eligible, and it's quite a limited list. So it's a strategic process. The health ministers have nominated key specialties in Australia that are in most demand that they want to see assessed and set up for this pathway. And so the colleges have been asked to advise about what specialty qualifications should go on it. But importantly, the colleges do not assess. They've informed or negotiated with the Medical Board of Australia which qualifications might go on the list, and then the Medical Board does the assessment itself. There is a period of required 6 months peer review as part of this process, but there's in terms of the sort of requirements post being made eligible and working, it's very light compared to the normal specialist pathway. So you can see that these are the specialties that are now on the list. They actually started with general practice in I think that was early 2025, and then in late 2025, anesthesia, obstetrics and gynecology, and then psychiatry went on list. And the 2 new additions are from the College of Physicians. So the Royal Australasian College of Physicians is a very big college here in Australia. It does both adult and child medicine, and quite a few other things. And they have many, many specialties. I think something close to 30 subspecialties. So they only looked at the two main generalist specialties, which is general pediatrics and general medicine. Okay, and they've now been assessed for expedited pathway. So this is, as you can probably gather, part of the focus here is on generalism. So specialties that are generalist in nature are being prioritised for this list. So the other two new additions, they've only gone on in the last couple of weeks, and we'll talk about whether you might qualify for them shortly. But just to note, the next on the list are radiology, dermatology, and emergency medicine. Again, fairly general specialties that are in most specialties here in Australia are in demand in some parts of the country, particularly in the rural and regional. And then interestingly, two surgery specialties, general surgery and otolaryngology, or ear, nose and throat surgery. And that's interesting because the College of Surgeons did announce last year that they had discussed with the government that surgical specialties would not be being assessed for the expedited pathway. So that seems to have altered. And it's interesting because the College of Surgeons is probably of all the colleges in terms of those assessing the specialist pathway. Yes, so all the colleges in terms of performance around assessing the specialist pathway, College of Surgeons has been one of the worst performing in terms of their timeliness and assessment. And they had to actually also put out a joint statement last year about how they'd been adopting the wrong process in terms of assessments as well. So interesting that story about non-consideration for specialist pathway appears to have altered. Okay, but you want to know if you're in these specialties, are you eligible? So let's drill down. In fact, I think we can go here. This section explains the process by which specialties are assessed. So the jurisdictions nominate them, then they consult with the colleges. They put together a framework together with the Australian Medical Council, two separate bodies, by the way, the AMC and the Medical Board of Australia. Then they come up with the qualification list. Now, the main reason that you will see less countries on this list is largely because the colleges, when they are being asked to consider qualifications, they generally have a lot of data around the UK, to a lesser extent Ireland, and then not as many for the US and Canada. And so they have less confidence around those countries, and you'll see that has led to a more refined list of countries than you would expect with the competent authority pathway. New Zealand qualifications, if you're fellow in New Zealand of the college, the relevant college, you're generally eligible in Australia, so that gets around that issue. So let's look at the list. So here is our list. I'll go to the two new ones firstly. So general pediatrics under the College of Physicians. So they've deemed that the relevant Irish qualification here is relevant. Now, importantly, you need to read the fine print, because another difference between the expedited pathway and the competent authority pathway is you can't qualify from one country and then go to one of these authorities and qualify. So in many of these countries, you can do the equivalent of the specialist pathway and be a specialist, say from India, go to Ireland, get upgraded. That does not count for the expedited pathway. You would have to go through the normal specialist pathway in that sort of circumstance. So basically, you have to have the membership of the college and the certificate of satisfactory completion of specialist training. And so you can see the list there. Yeah, and so there's a little bit more detail there. Similarly for pediatrics for the UK, same thing, membership of the UK college with a certificate of completion of training. So no CESR, okay? And then the other new one, which is physicians, again, general medicine, again under the Royal Australian College of Physicians. You need membership of the Royal College of Physicians together with a certificate of completion training. And interestingly, the training here, it says, has to be completed in general and acute medicine curricula. So you may be wondering, well, I've completed my MRC in the UK, but I'm a cardiologist. Am I eligible? No, not unless they've done internal medicine training. And let's just check that up here as well. It'll probably say the same for pediatrics. It has to be, so same thing. You can be dual qualified, but if you're intending to apply for general pediatrics and something else, you'll need to go through the specialist pathway. So it's restricted to the generalism there. And of course, then the other one that were done last year, anaesthetics, basically similar. You can either be qualified in Ireland, having done the training there, or the UK. General practice is Ireland, New Zealand, because there's a different college in New Zealand for general practice, different to the RACGP and the ACRRM in Australia, and the United Kingdom is same college of the general practitioners there as well. So again, you have to have done the training program in that that country, basically. Obstetrics and gynecology, also the Irish qualification counts as well as the MRCOG. And then finally, what have we got left? I think we've just got my specialty of psychiatry. So interestingly here, and you notice this with internal medicine for adults as well, the College of Psychiatrists have determined that the RC Psych is applicable along with the certificate of completion of training in that. The interesting thing with psychiatry, because we're a general specialty here, you may have some, if you're a psychiatrist in the UK, you may have some extended training in other areas, but you would still be eligible because you've got the CCT in psychiatry. So there you go. The new specialties and a little bit more information about how they've been applied or decided upon for the expedited pathway in Australia.